Good evening. My name is Asia Thornton and I'm in Philosophy 250. I'm a student at the Bryan and Stratton Richmond location and I'm in Associate's Degree in Nursing program. Over the past 7.5 weeks, I have learned so much in philosophy in such little time, but I can definitely say that it was a lot of good information that I look forward to using. One of the topics that stood out the most, and it is an institutional outcome, was critical thinking. The reason I'm discussing critical thinking is because I was able to critically think on my portfolio project to put it all together. I will continue to use the way I critically think and learn how to critically think from philosophy in my career now, which is an LPN in a pediatric clinic, and when I become an RN, because I know I'll be using it every day. To describe workplace compatibility tolerance, I can say that tolerance is being able to work with something or someone that's out of the norm. Being able to tolerate a person from a different race, religion, cultural background, anything. I feel like that is what tolerance is. I feel like tolerance ties a lot into what patience. Having patience and tolerance is a big thing in the work field. Tolerance ties into my portfolio project because I discussed how I feel that adolescent privacy is very important, because if they feel like they, do not want to talk with their parents just yet about sex education, about oral or not even oral contraceptions, but any contraceptions, pregnancy, anything like that, I feel that it will be okay, to keep that from the parents. As long as it's not self-harm or harming others, then I feel like it will be okay. I feel like being able to tolerate the backlash from the patient parents, families on how can this minor come in the clinic and talk one-on-one with the doctor and the parent not be involved. So being able to tolerate situations like that is very important within the workplace. And I feel like that's how tolerance runs into with my portfolio project. The other workplace compatibility that I like to discuss is attitude. Having a strong and positive attitude in the workplace is very important. If you come into work having a bad attitude, being rude to others, I'm a firm believer that attitude triggers attitude. So I feel like if you have an attitude, it will cause your patient to have an attitude, your coworkers to have an attitude. So keeping that strong, positive attitude. Some of the strategies that I used on my portfolio project was being able to critically think, being that I work in an adolescent clinic and actually see day to day that comes up in the clinic, it was able to help me form my portfolio project. I just want to say I thank Dr. Japola for her positive feedback, working with me, helping me understand when I was not quite sure of what was the topic that was going on at the time. I want to thank my classmates for the discussion posts, helping me out when I needed help. And best wishes, thanks to everyone, and have a good night.